It's just ticked over to 10 a.m. this morning, so we will get started. Hi, everyone. Thank you so much for joining us this morning for our Clearing the Air webinar with the Cancer Council. So my name is Olivia and I am one of our project officers here at Kidsafe WA. And I do have Nikita here from the Cancer Council Western Australia joining us this morning for this webinar. So thank you everyone, whether you are watching live or you are watching via the recording. I do just have a few housekeeping items before we do begin this morning. So our webinar will run for approximately 45 minutes this morning. And if you do have any questions, please do feel free to pop them into the chat function, and we will go through those questions at the end. I would firstly like to begin by acknowledging the traditional custodians of the land that we are meeting on today. We are recording this morning from our office here in West Leederville, which is the land of the Whadjuk Noongar people. And I would also like to pay my respects to elders past, present and emerging across Western Australia and also from where you are listening in from today. So who is Kidsafe? Who are we and what do we do? So for those of you where this is your first interaction with Kidsafe, we are the leading not-for-profit organisation dedicated to promoting safety and preventing childhood injuries. And we do this through, advocacy, education and research. And we are really lucky to be funded by the Department of Health Western Australia to sort of reach out to parents and carers and just make sure all of our little ones are nice and safe. And why do we exist? So we know that injuries are the leading cause of death amongst Australian children. And we do know that more children die from injury than from cancer, asthma and infectious diseases combined. This does tend to surprise a lot of parents, particularly parents of young children, as oftentimes injury is just not really on the radar and there is, quite a lot of other things to think about. But when we are talking about children today, we are sort of talking from that 0 to teenage years, and we will be focusing on those late teen years in this webinar this morning. So we do know that over 24 Western Australian children do die from those preventable injuries each year, while a further 8,000 are hospitalised, which is pretty significant. And we do know that many of the deaths and injuries we do see can be prevented, which is really, really amazing. And it's through webinars like this that we really can get that information out there. Also, just looking at injury location, it's really interesting to see where our injuries are happening. At home is number one. We know kids of all ages spend quite a lot of time at home, so it's probably no surprise there. And then once children start to go to school, it's again, no surprise, we do see quite a lot of injuries there. And when they are, engaging in sporting activities, different sporting clubs, again, it's just a no-brainer that we do see injuries there. So just a bit of food for thought and something to think about when we are sort of looking after our little ones and all of those injuries that they do get. And now just briefly touching on the top 5 injury causes that we see. So number 1 is falls. So over all age groups, falls is the most common. And particularly for older children, this may be a fall off, a skateboard, a bike, a scooter. And oftentimes we see a broken bone, a sprain or strain. And in some cases, we can see quite a serious head injury. So falls, they are quite serious and they do happen quite a lot. And this is then followed by mechanical forces. So it sounds like a bit of a scary word, but essentially just what that means is, blunt force, cutting and piercing. And a common example of this is when older children may be playing sports and potentially they've collided with a teammate or an opposing teammate, which can, result in a concussion or quite a serious head injury. So again, that is quite high amongst children. Third, we're seeing here is transport. So this can include being injured. We sort of spoke about it before on a bike, a scooter, a skateboard, or also it can include when older children do begin to drive and get their driver's license. Unfortunately, there can be some, serious injuries involved there as well. So again, just some food for thought and something to think about. And point 4 and 5, so poisoning and burns and scalds. This sort of nicely leads into our guest speakers today. So we do have Nikita, as mentioned, from the Cancer Council Western Australia with us this morning. And she'll sort of be discussing vaping and some vaping related potential injury risks and just different ways that parents and carers can support teens with, vapes. I know it is an emerging issue, so it's really awesome that we do have her here today. Now, please bear with us for a moment. We'll just stop sharing screens and we'll get Nikita's slide up and running.
All right, thanks Olivia for that introduction, and hopefully you are able to hear me and see my slides as well. In case there are any issues with the presentation or if at any point you can't hear me, just please let me know. My name is Nikita Bhavsar, and I am the Community Engagement Coordinator for the Clear the Air program at Cancer Council Western Australia. I'm also joined online by Lorena Chapman, who is a teammate and senior coordinator for Clear the Air. So on today's agenda, I have about 30 minutes of content, and essentially I am aiming to update you with some recent statistics on vaping in young people. I will also go over the contents of what is in vapes. I'll then quickly go over some known short and long-term health risks of vaping. And then in closing, I'll talk about support that is available for young people, some referral pathways, and other resources for parents, carers, and professionals who work with young people. I would also like to acknowledge the traditional custodians of country throughout Western Australia and recognise their continuing connection to land, waters, and community, and pay my respect to their elders and extend that respect to all Aboriginal peoples living and working in this area. So to begin with, I'd just like to give you a little update on who we are and what we do. The Clear the Air team is a part of the Make Smoking History team at Cancer Council Western Australia. Make Smoking History have decades of experience with anti-smoking campaigns, as well as research, advocacy, and targeted interventions to reach people who are impacted by high tobacco use. And so the Clear the Air team's work mainly aims to reduce the rates of vaping in Western Australia. And this is through a comprehensive approach that includes delivering digital education campaigns to raise awareness about the harms of vaping to young people and prompting quitting behaviors. We also commission relevant strategic research, provide capacity building opportunities and resources for professionals who work with young people, and advocating for strong policy reforms. So to begin with, I'd like to present some key recent statistics on vaping in young people. On this slide, we have some Western Australia specific data from the Australian Secondary Schools Alcohol and Drugs Survey. So this survey is undertaken every 3 years, and it surveys secondary school students aged 12 to 17 years from across the country. Now, I don't have this on the slide, but Australia-wide, the survey found in 2022-23 that 1 in 3 or 32% of secondary school students had ever tried vaping. And this has significantly found to have increased since 2017, when the percentage was 13.5%. Talking about the graphs on this slide on the left, we have past month smoking and vaping in Western Australian secondary school students. So there is the pink line, which is the proportion of students in WA who had vaped in the past month. And this was significantly higher in 2022-23 at 18.4% compared to 2017 when it was at 4.5%. In contrast, we have the blue line, which indicates past month smoking, which has steadily declined. The graph on the right, we have susceptibility to smoking. And we can see that 16.4% students who had never smoked were susceptible to future smoking. And this is a significant increase since 2017 from 12.8%. So this means that when students were asked about their intention to smoke in the next 12 months, they gave a response other than certain not to be smoking. And this measure of smoking susceptibility has been shown to be a strong independent predictor of smoking experimentation among young people. So this is a concern as there is recent research indicating that young people who vape are 5 times as likely to take up smoking as compared to their peers who have never vaped. And the research showed that the link was strongest for adolescents at the younger end of that 12 to 17 age range. And the younger a person started using vapes, the higher the increased risk that they would subsequently try smoking. So the researchers found that 12-year-olds who had vaped were 29 times more likely to go on to try smoking than 12-year-olds who had not vaped. So that's all the stats for today. I'll be talking a little bit about some of the targeting by the e-cigarette and tobacco industries, specific targeting of young people. So the increase in vapes used by young people reflects marketing tactics, leading to increasing interest, trialing, and regular use. So originally, vapes were marketed as smoking cessation tools for adults, and now they're clearly marketed at young people. So on this slide, you can see just a small selection of the shapes and the colors that vapes come in, as well as the several fruity flavors that they come in. So at first, it is the bright colors, it's the sweet flavors that lure young people to vaping, but then it is the highly addictive nicotine content that can keep them hooked. The marketing of vapes is largely targeted towards young people through social media influencers, user-generated content, ads, sponsoring of music festivals, using style trends in promotions. There's also commercial relationships with international motorsports, for instance, the F1, and the designing of products to appeal to younger people. So products are highly visually appealing. They come in lots of various flavors, and they have a low price point. So vaping content has flooded social media, contributing to the view that vape use is socially accepted and thereby encouraging the uptake of vapes. The messaging around vaping is also predominantly positive, which contributes to the view that vaping is very common, it is socially accepted, and it lowers the perceptions of harm and supports the use of vapes. So what are vapes and what is in them? Vapes are battery-powered devices that heat a liquid called e-liquid to produce a vapor to inhale. Vape aerosol is not water vapor. The main ingredient in vapes is propylene glycol, vegetable glycerin, or glycerol. And vapes and e-liquids can contain a range of chemicals such as acetone that's found in nail polish remover, acrolein that's found in weed killer, and 2-chlorophenol that's found in cleaning products or bug spray. And although vape packaging might list some of these ingredients, it may not include all the chemicals in vapor. And researchers have found that many of the substances that have been identified in vapes were contaminants from either the e-liquid, the device itself, or the emissions that follow on from the heating of the e-liquid. Now, most vapes contain nicotine, whether or not it is stated on the label. Many illegally sold vaping products are not correctly labeled. So, for example, they contain nicotine, although they're labeled as non-nicotine vapes. And a study in 2019 found that 60% of vapes contained nicotine, although they were labeled nicotine-free. The nicotine in one vape can equal to 50 cigarettes. And we know that young people who try e-cigarettes are 5 times more likely to take up smoking. So why is nicotine dangerous for teenagers and young people? Teenagers become more easily and more rapidly addicted to nicotine than adults. The human brain is still growing and developing until about 25 years of age. And during these younger years, the brain forms billions of new connections between brain cells when learning new things, practicing skills, and having new experiences. So nicotine harms the way in which a teenage brain develops. Nicotine exposure during these critical times of brain development can lead to changes in both the structure as well as the function of the different parts of the brain that control learning and memory, impulse control, emotional regulation, attention, behaviors, mood, and executive functioning. So things like organization, planning, working memory, and flexible thinking. In terms of the health harms of vaping, vaping is not safe. The evidence of the harm is emerging. The long-term effects of vaping aren't known yet, but what we do know right now isn't great. We are also seeing the social impacts from vaping, such as behavioral problems in schools. Many of the chemicals that are found in vapes are known to cause cancer, heart disease, as well as lung disease. And vaping has been linked to permanent and serious lung disease. In terms of short-term effects, some short-term effects include irritated mouth and airways, persistent coughing, feeling out of breath, as well as breathing problems. And people who vape may also suffer from headaches, dizziness, feeling nauseous, vomiting, and there have been cases of seizures from inhaling too much nicotine or swallowing the nicotine e-liquid. I did mention earlier that nicotine dependence or nicotine addiction can lead to feeling more stressed or anxious, and it can worsen conditions such as anxiety and depression. Vaping during pregnancy may harm the developing baby. And then there are also some safety risks to consider from vaping. Vapes can explode or catch fire. So burns and injuries from overheating or exploding vapes can cause life-changing injury, disability, disfigurement, or even be fatal. The burns and injuries are mostly commonly occurring on the face or genitals when vapes are kept in pockets. And e-liquids are poisonous if swallowed. So nicotine poisoning can cause seizures and can be fatal. So to tackle the issue of young people vaping, it is important to understand why they're doing so in the first place. The use of vapes has been found to be driven by an internalized desire to fit in, so an injunctive norm rather than overt external peer pressure. And norm formation is strongly influenced by social exposure, including the way in which vapes are promoted. So young people perceive vape use as being quite common, acceptable, and normal. But the high perceived prevalence of vaping among adolescents is actually inaccurate when we look at the data. That's not what we see. And this needs to be challenged so that young people don't think that it is acceptable or the norm. So I do have a lot of content on this slide, and I won't be going through all of it, as you will have heard about the changes to the regulation of vapes. The new vaping regulations are important to further prevent young people from starting to vape and also supporting those who are already vaping to quit. So in essence, vapes are now only available for purchase at pharmacies. From 1 October, they were to be available for adults without a prescription. However, the Western Australian government have amended the regulations, meaning that any person under 18 or over 18 still needs a medical prescription before they can obtain a vape from a pharmacy. So essentially, it is illegal for non-pharmacy retailers such as tobacconists, vape shops, or convenience stores, anyone other than a pharmacy, to sell any type of vape. And the Department of Health is working hard to enforce this unlawful sale of vapes and is working closely with the Therapeutic Goods Administration to strengthen enforcement efforts. So if you do know of any non-pharmacy retailers selling vapes, you can report them. You can do so by contacting Crime Stoppers on 1800 333 000, or even online at crimestopperswa.com.au. Please do encourage reporting of illegal vapes, as this will assist local police, the TGA, and the Department of Health in gathering intelligence that can then inform their compliance and enforcement efforts, and to crack down on the local illegal vape sellers. So reports can be made anonymously, and there are significant penalties for unlawful importation, supply, and the commercial possession of vaping goods. And this includes 7 years in jail and or $2 million fines. So the Council of Western Australia has been advocating for a long time, alongside our key stakeholders, for stronger reforms. And reforms are one way, an important way of reducing the prevalence of vaping. And alongside reforms, we also need to raise awareness about the harms of vaping and prompt quitting behaviors among those who are vaping. So we do this through our educational campaigns, which brings us to the work that we're doing with the Clear the Air program. In 2023, Cancer Council Western Australia received funding from Healthway to develop a campaign, a vaping prevention digital campaign for young people aged 14 years to 24 years. And the campaign aimed to raise awareness about the harms of vaping, prevent uptake among those susceptible to vaping, and encourage quitting among people who are already vaping regularly. So the Clear the Air brand was developed, and the Rotten Fruits campaign was launched in October 2023. And this ran through to the end of June 2024 across various social media platforms like Instagram, Snapchat, TikTok, also streaming services and mobile apps. And the campaign directs young people to the Clear the Air website, which you can see on the right side. This is a mobile-friendly website, and on the website you can find information about the chemicals in vapes, the health harms of vaping, nicotine addiction, signs that you may be addicted. There's also a quiz, so you can take a quiz to find out if you are addicted, and how to quit vaping and stay vape-free. So this website is still up and running, and you can access it at www.cleartheair.org.au or simply through the QR code on the screen. One of the aims of the campaign was to raise awareness about the harmful chemicals in vapes. So here you can see some ads or videos that were converted into posters that we've been providing to our partner organizations and stakeholders. On this slide, I have some data on how the campaign evaluated. So there were 70,000 plus individuals who visited the Clear the Air website from October 2023 to June 2024. And 3,500 people completed the Am I Addicted quiz. And interestingly, 83% of those scored moderate or high on the addiction. There was also an online survey of 300 Western Australians aged 18 to 24 years. And that indicated that 1 in 3 recalled the Rotten Fruits campaign, and among them, 2 in 3 saw it 2 or more times, and that people who vape were more likely to recall the campaign than non-vapers. I also have some data on the cut-through and the impact of the campaign. I won't be discussing that in detail, but it overall points to the campaign evaluating well. So with the new reforms, it is possible that we will now have a lot of young people requiring support to quit vaping. And that shifts our work and messaging from just being prevention focused to prevention and support to quit. So in terms of what is coming next, we have the Quit Kids research. So that's currently underway, where we're looking at the acceptability among young people of public health messages about vaping cessation and how they would like to seek vaping cessation support. We've also received additional funding for campaigning work and for the community-based capacity building side of things to reduce the prevalence of vaping in children and young people. So our new campaign will be focused on young people 14 to 24 years of age. And this will have a particular focus on rural and remote areas and low socioeconomic populations. In terms of the community-based work, we're hoping to support a range of professionals as well as community-based organizations and professionals who work with young people. So this could be health professionals, community service organization staff, sporting professionals, youth workers, youth development officers, to build their capacity and equip them with resources that they need to support young people in preventing vaping or providing quit vaping support. I do have some resources for young people, including referral pathways and information for parents, carers, and other professionals in the next few slides. So Quitline is a free, confidential, and welcoming professional behavioral counseling service that can support people who want to quit smoking and vaping. So when you contact Quitline, you speak to confidentially a qualified counselor who can answer your questions without judgment and offer advice and support you on how you would like to quit. So all Quitline counselors are qualified to work with youth callers. For youth, adult consent is not needed to undertake the counseling service. And all young people who enroll in the callback service are assigned with a key worker to maximize the building of rapport and ensuring consistency of care. Health professionals can also refer patients to Quitline. And research shows us that proactive referral compared to recommending a person to call can increase uptake and improve outcomes. Anyone can call Quitline to receive information and support, so that includes parents, teachers, and health professionals. The Aboriginal Quitline is a culturally safe service where you can request to speak with a counsellor for Aboriginal and Torres Strait Islander communities. And Quitline is also a culturally safe space for LGBTIQA+ communities. There are many different ways to contact Quitline. You can call Quitline, request a callback, and there are also text-based options such as through Facebook Messenger or through WhatsApp. And the website, Quit's website, also has a web chat where you can message them. So please use the QR code on the screen to learn more about Quitline. A young person's local general practitioner can be another referral point. And if you are a GP, there has been an update in terms of the information and guidelines available for general practitioners through the RACGP update, which came through in October 2024 and has a dedicated section on vaping cessation. As a parent or a caregiver, you have an important role in protecting your children from the harms of vaping. And it is recommended that parents learn about vapes. If you suspect your child is vaping, do take the time to talk to them about it and help them understand the risks of vaping. So here I have links to 2 QR codes that link to 2 different conversation guides for talking to young people about vaping. Now, stopping vaping can be hard sometimes, and your child may need advice from a general practitioner. Finally, if you are a user of vapes, please ensure that you don't vape when children are nearby. Passive exposure to vapor can be damaging for children and young people. Always keep vapes and e-liquids locked away and out of reach of children. And if you think someone has been poisoned by nicotine, call the WA Poisons Information Centre on 13 11 26 immediately, or 000 if it is an emergency. You are an important role model for your children. So if you are looking for support to quit, have a chat to your doctor or reach out to Quitline or visit the Make Smoking History website for more information and tips. Additional support is available through the My Quit Buddy app, and websites such as quit.org.au are also helpful. There are also resources available online at the Cancer Institute of New South Wales website and the Australian Department of Health and Aged Care, and as I mentioned before, through the Aboriginal and Torres Strait Islander Quitline. There's also Uncloud, which is a campaign that is specifically targeted towards young people. I have a few more resources on this slide, including some that are Western Australia specific. So the Western Australian Department of Health, Healthy WA, and the Department of Education, Western Australia. There's also a link to a research project on the health impacts of vapes at the Australian National University, a link to the Therapeutic Goods Administration Vaping Hub, which has information on vapes are defined and regulated in Australia, and then finally some links to some facts on vaping. So that's it for me in terms of the Clear the Air update. If you are a professional working with young people, we'd love to hear from you to better understand how we could support you in building your capacity to have more confident conversations around vaping prevention and quit support. And I'm also happy to take any questions that you may have now. Thank you.
So just to wrap up today, I will go through some of the additional programs and services that we do offer here at Kidsafe WA. So we have sort of 3 main program areas. of most use, I think, to most of the people listening today will be our home service. So we do offer quite a lot of parent and student education workshops. So these are, as I said before, we are fortunate enough to be sponsored by the Department of Health. So a lot of these sessions are free, and we do talk about a lot of the common injuries that we see and ways that we can support and look after our little ones. Also got webinars like the one that we are watching today, and all those previous ones are popped up on our website if you would like to have a look through. And we also have a safety demonstration house at our office in West Leederville. So it sort of mimics a safe house, and you can walk through and see different sort of ways that you can keep your home nice and safe. And then we also have a child car restraint service. So if you do have quite young children in your life, you can come to us and we can help with checking or fitting your car seat. And if you do have questions, we can answer those. And we also hire out car seats, which is another really great option for families. And lastly, we do have a playground service. So essentially we go out to playgrounds and just make sure they are nice and safe. And we do offer a whole range of workshops in the playground space as well. So just to wrap up and going forward from today's webinar, I highly encourage anyone listening to save the Poisons Information Line number. I know Nikita did speak about it earlier, but it is a really important number to have saved, not just for young children, but also for those teens and, even other adults in our life. You can call this number and they'll sort of give you advice on what to do if you do suspect someone has swallowed a poison. Not just talking about vapes, it can also be, cleaning products, all those sorts of things as well. So I highly recommend having that number saved. I do also recommend having a little look at the range of resources we do have on our website. So you can see the link on there, and we do have resources on a whole bunch of injury topics. Also checking out the Cancer Council's Clear the Air website. I know Nikita did pop it up on the screen before, but again, if you do need support and you do need sort of tips and ways to sort of speak to your young one, definitely hop onto that website and have a little look through there. And lastly, Kidsafe WA are also on Instagram. So you can pop on there, and we do post quite a lot of safety tips there as well. And lastly, today, we would really, really appreciate any feedback. So we do have a quick couple of minutes survey there. So if you do have time, we'd really appreciate you filling that out and any feedback that you do have. But that brings us to the end of our webinar today. So if you do have any questions, please pop them in the chat or the Q&A function, and we can answer those for you now. Otherwise, please do feel free to reach out to either myself or Nikita, and we can answer any questions you do have as well. But again, thank you so much for listening, and we hope to see you at another webinar shortly. Thank you.